This video is about preparing and feeding OxBow's critical care supplement to medically challenged guinea pigs. Now, there are two types of these powders that OxBow produces. One is a fine powder version, which is what you see on the video in a brown and silver bag. And they have a coarse version, which is more rough powder, and that's in green and silver bag. I like using this fine powder version because it's easier to mix and administer this product using a feeding syringe. I'm going to make enough for one feeding for my guinea pig, who is around 10 years old. I'm going to use about 2 scoops. I have a little tiny dish that I bought for this purpose, and you can just use your own judgment as to how much you want to mix, but I'm making just enough for one feeding and have a little bit left over for the other guinea pigs to lick on. So I'm using a bottled water here because I don't really drink water from my own faucet, and I'm going to use the best available water for my guinea pigs when I'm trying to nurse them back to health. So I'm just using a cap, and it's important not to just pour the water in without these portion control, because it's very easy to put too much water and make the whole thing too liquidy, and that's not what you want. So I've learned to use either a tiny spoon or a cap to carefully pour the water. About 2 spoonfuls is good to start with, and I mix them with toothpick to mix the product, because if you use anything besides a toothpick, you're going to get some of this product onto whatever utensils that you're using, and that's just going to create more waste when this product is expensive enough, and I want to use everything up. So here you see a paste that is just not too liquidy enough to be sucked up by a syringe, so I know that I have to add a little bit more water now. I'm just going to continue to mix and mix, and that's not enough water, so I'm just going to add just a little bit though, because you don't want it too runny. Here I'm just going to add one more cap and see how that goes. And this is all by trial and error, and you will learn as you do this what works best for you. Taking the time and patience to mix this carefully is something I had to learn through many trial and errors. Now this is starting to look better, but you still see some lumps, and it's not really ready yet to be sucked up. I'm just going to add a drop more. I'm trying to make up my mind if this is enough, and no, it's just not going to be smooth enough for the syringe to be sucking it up. So here we are, just a tad more. Now if you put too much water, what you do is if it's too much, then you add more powder, and to get the consistency back to what you want. But that's going to create more of the product, and if you have more than one guinea pig, that's fine. You can give the leftover to the other guinea pigs. They'll just lick it right up. They all love this. Or I can make another syringe and store it in a refrigerator, which I'll talk about later. But you can't just keep it in a dish though. You're supposed to discard everything after you're done feeding. That's what it says in the bag. So here we have some syringes, small ones, mediums, big ones. And my best advice is that you buy the largest possible syringe with the longest tip and the largest opening. It just works the best in terms of being able to get the product into the syringe, and as well as the comfort of the guinea pig to be able to latch on to the tip as they get fed. It just didn't work with the others. So here I am. I have the right consistency and I'm trying to suck up the paste. Now, this is a slow process. You can't just suck up everything at once, as you'll see. You can do a little at a time. And that's about the most I can get in one shot. And this is the way I do it. I just start tapping to get the paste down the syringe. Be careful not to push the syringe up so the paste comes out. You're just tapping it. And then you push it back up and you start the process over again. You try to suck a little bit more and do it slowly. And I keep tapping on the syringe bottom without pushing the inside thrust, because if you do that, you're just going to squeeze the paste out of the syringe head. And I go for another shot of sucking up more paste. The slower you do it, the better, because if you do it too fast, you're not going to suck anything up and you're just going to get a huge air pocket. So you just got to do this little by little. Now, if you are able to get all of it in one shot, then your paste might be too runny. And what you're going to end up doing is feeding guinea pig just a lot of liquid, and it's not really going to be feeding. It's going to be more of a liquid intake. And I just prefer to have this consistency where it's just enough to get it up your syringe, but not too runny and not too pasty. Tap, tap, tap. Now this is about 5 milliliter right there. You can't really see it because I've used this syringe so many times and the markings are already rubbed off. I would say that, you know, you want to aim for at least 5 milliliter worth of paste if you're feeding a guinea pig. If not 10, I go for around 6. And it depends on how frequently you're going to be feeding. I try to feed my pig twice a day, so 5. If I get 5, that's good enough, and I'm just going to do another 5 at night, 1 in the morning. My guinea pig, I put him in a little cushion and I feed him very slowly, and you can see how he can raise his arm. That tells me stop. He had enough in his mouth. He has to first digest it, so I stop until he is okay for more. As you can see, he will take away his little hand to signal that he can handle more. But he raised it again, which means I have to go slow. I have to go slow, and if I don't listen to his signals, I'm going to end up spilling this paste all over him because he just won't be able to keep it in his mouth. Also, sometimes if your guinea pig doesn't give you the arm signals, then you should look out to see if he will come and latches onto the head of the syringe. See, I take it out to see if he still wants to suck on it, and that tells me that he wants to eat more. And I push just a little bit, and then I stop, and I push a little bit more, and I stop. And you know, this whole feeding takes a while. I used to just push it right through and thought that he'll just eat it all or get it into his mouth. But I realized that's just not a good way to feed a guinea pig. You really gotta know how fast your pig can handle eating and just go very slow. Be prepared to sit with your pig for a couple of minutes. And here he's asking for more, which is a good sign. Sometimes when they're really not feeling well, they wouldn't even be asking for it, so you're going to have to sort of get a little bit more. I wouldn't want to call it aggressive, but you got to make them eat a little bit, and sometimes you're going to have to push it in. Today he's feeling a little better. And this guinea pig, there's nothing really wrong with him except that he's very old. And he's not able to eat on his own too well anymore because he doesn't really come out of his hut because he has arthritis. So I just want to make sure that he's getting the nutrients that he needs. And that is how I feed. Critical care to my guinea pig.